really great to have you there. So this is our first webinar, and as you already know, this is about a webinar about diabetes oral medication, insulin injectable therapies. So we are going to talk about, as you seen in our agenda, about Metformin, Gliclazide, the group of tablets we call the Gliptins in general way, GLP-1s, and Gliflozins. We're going to have a quick Q&A with your questions for me. So just for you to know a little bit more about me, my name is Ines Paro. I am a diabetes specialist nurse. I live in London. I started the website Diabetes because I'm really passionate about diabetes, and I really love to do this this project. I'm the co-founder of DAYBETES.com, as my future husband is the founder. He had all this idea to do a website. So going to our main, this image is just to show you how diabetes affects different systems in our body in someone that is diagnosed with diabetes. So as you can see, there is different things that happens in different organs in our bodies when we have diabetes. That's apart from the problem itself of the pancreas or the insulin not being produced enough, or the pancreas struggling with the production of insulin. There are also other factors that increase the glycemic levels in the blood sugar levels in our body. So if you look in this image, you have, for example, in someone that have diabetes, the liver delivers an extra dose of glucose to the bloodstream, which will, on top of already the problem that the person with diabetes have of a raised high blood sugar, the liver will deliberately just deliver some glucose in the bloodstream. So also in our gut and stomach, there are some what we call incretins that are reduced in a person with diabetes, in opposite to someone that has that doesn't have diabetes. Incretins usually are part of our gut and helps everyone to have less hunger. So there is a connection between the brain and the presence of these incretins in our gut that will tell the brain that, okay, we are full, we don't need to eat anymore, or it will help the stomach to empty in a slower pace. Of course, with the pancreas, with diabetes, you have a pancreas that it's with diabetes type 2. You have a pancreas that in the long term will get less ability to produce insulin, or the insulin that it produces is not enough. Heart control, as I said, is connected with the incretins. To the renal, there is some discoveries and studies that show that with a person with diabetes, you have more reabsorption of the glucose. So usually in a person without diabetes, you have a normal absorption of glucose. It's not raised, but in this case, with the person with diabetes type 2, you have more absorption of glucose. Of course, regarding diabetes type 2, in one pulsing here, and diabetes type 2, you have, as you know, the insulin resistance. When you have fat around your organs, your organs are not really understanding that there is the presence of insulin there, and that's why there is the pancreas is forced to produce even more insulin. And as you can see in this image, it shows that this is where the medication that patients with type 2 diabetes are focused on. So we think about, okay, what is causing this hyperglycemia, this raised high blood sugar levels, and can we use to stop to blood sugar. So starting now about metformin. So it's a really common medication, and there is different brands. So I just put here a general box of metformin. Usually thinking about the previous slide, it improves the sensitivity of the body to insulin, or making that the insulin resistance that usually is connected with type 2 diabetes will be reduced, because the tissues will be more responsive to the presence of insulin. Avoid also the extra glucose delivered by the liver. As I said before, the liver in the person with type 2 diabetes usually delivers even more. There is no really control of the liver to release some extra glucose in the bloodstream, and this will bring the reduced blood glucose levels. Also with metformin, even though I know that not everyone will have a great belief in metformin. Metformin gives really great outcomes in blood glucose control, and there was some studies done in the past, a really big study done in UK, that states that metformin also can prevent some cardiovascular events. So it's a really cardioprotective drug, if I can say this, but basically in the amount of patients they did the studies on regarding diabetes, obesity, and cardiovascular outcomes and problems, they found out that patients on metformin had less risk of cardiovascular events. So tips and more about metformin. So really best tip to give you is this, that it's take the tablets on a full stomach, because metformin has associated with really difficult side effects that we will see in the next slide, and these side effects usually will make the patient to stop taking this tablet. So if you take in this full stomach, you will trying to avoid these side effects in a better way. Of course, if you're not coping with the side effects, don't give up yet. As I said, this metformin is a really good medication, and request your doctor for modified release. Or sometimes it's important to reduce the dose. That's something that also can be done. Metformin on its own doesn't cause hypoglycemia. So hypoglycemia, we talk about less than 4 if we're talking about millimole per liter, the unit. And in time, it reduces the vitamin D levels, and maybe some of you are doing some tests already on the vitamin D levels, or taking tablets for it. So the side effects, the frequently reported ones, are stomach pain, stomach discomfort, diarrhea, nausea. And again, if you're struggling with this, try to take your tablets with your meal, or talk with your doctor to think about modified release. The maximum dose of metformin is up to 2 grams per day. There are some patients, depending on the patient and on the clinician, that will prescribe 3 grams of metformin per day, which is possible. But again, with your main meals, and if you're having side effects and not coping with the side effects, such as the ones you're seeing in the screen now, please talk with your GP or your doctor and reduce your doses, or switch to a modified release. Going now to Gliclazide, this is a really common medication also. So Gliclazide, way that stimulates the pancreas to produce bigger amount of insulin, and it reduces, of course, reducing the glucose levels. Basically, when you take the Gliclazide, it will tell your pancreas, okay, it's time for you to work a little bit more, so your pancreas produce more of your own insulin. Some tips and more. So these tablets should be taken before 22 of your meal. Don't take Gliclazide without food. Usually we say, or you reduce the dose. If you're not, for example, usually they are taken in the morning before breakfast and before dinner. usually, because that's what we consider that will be your main meals and your biggest meals. Take the glycoside if you're not eating, so the glycoside will tell the pancreas, okay, just work, but in fact there is not really extra glucose running in your blood. So usually we say, okay, just don't take the glycoside if you're already having hypos, for example, after you take the glycoside and you didn't eat. So try to, or at least reduce the dose or omit the dose for that meal time. Glycoside modified release is also an option. Usually we prescribe it only for elderly patients that tend to forget about the medication because the dose can be taken at once. So the maximum dose for glycoside normal release is 160 milligrams twice a day. So each tablet will have 80 milligrams. So you take 2 in the morning and 2 in the evening before your meal. Side effects, as you know, because there is this overproduction of insulin, you are at risk of hypoglycemia, weight gain, diarrhea, stomach pain, and sickness. So usually glycoside nowadays tend to be used slightly less because there are other good medication coming that are out in the market. So because of this weight gain, that it doesn't really help with insulin resistance and with the outcome of the diabetes and so that's what we tend not to use. Just depends on the situation, but usually they are being used in the or later in time, or there are other tablets that we tend to start using. So I don't know if you heard about the gliptins. So the DPP4 inhibitors, this is a posh name for it. It's the gliptins because they all the ending name, it's gliptin. So you have few examples here in the image. Here you have linagliptin, saxagliptin, and Januvia, which is the sitagliptin. So the examples are the same. I think it's just the vidalgliptin, the calvas, that it wasn't in the image. The linagliptin usually is used with patients that have some renal impairment, even though it can be prescribed just because it doesn't need any dose adjustment. So, and because all the other medications are metabolized in the kidneys, so if you have a renal impairment, the linagliptin will be your to help with your blood glucose control because it's metabolized in the liver and it's not going to be forced in the kidneys that are already with struggle. So this is quite a big text you have here, but this, as I said before, the DPP4, we talk about the incretins before, which is the incretins help the pancreas to stimulate the production of insulin also, which I didn't talk about, and reduce the production of glucagon, that it's also an hormone that brings the blood sugars high, but also it slows down the digestion, and I said, and decrease the appetite. The problem is this gliptins usually are broken down really quickly by the DPP4s. So you have someone with diabetes that already, as you know, and I told you already, that they have a reduced amount of incretins in the body, and they are being broken down, and think about not stopping working and being in circulation in your body by the DPP4s. So these gliptins they are going to the action of these DPP4s. That's why they are DPP4s inhibitors. So they will tell the DPP4s that always circulate in our body to stop breaking these gliptins, so we can keep them for longer and take them to keep them doing the effects that I just described you. The frequent reported side effects, so it's not really side effect, it's weight neutral. If you are, for example, just on metformin and a gliptin, you are really unlikely to have a hypoglycemia, and it brings the blood glucose down also. it can be taken, all of this medication can be taken alone or combined with metformin. As I said, there is no risk of hypoglycemia. Can be taken with or without food, so there is not really a problem there. And patients with history of pancreatitis shouldn't take this type of medication. And of course, your doctors and yourself should be aware of the kidney function to understand if they need to reduce the dose or, for example, stop the medication and start for a linagliptin just to prevent you to have more concerns with your kidneys. Going to the GLP-1. So these are the injectable therapies, non-insulin injectable therapies. I don't know if you're aware of them. We'll go through one of each pens in the image. So the GLP-1, as we talk about, they are the incretins again, that they are in a low concentration in people with diabetes. So we are giving more incretins to our body when we are on this type of insulin. So it enhances satiety, making you eating less. The gastric emptying is delayed, stimulates the pancreas to produce insulin, as we talked before, improve the blood glucose levels, and reduce the hepatic glucose production, meaning that it's not stops the liver to deliver more glucose to the bloodstream, making it the blood glucose levels reduced. Some side effects, these are really common: nausea and vomiting. This is more nausea tends to wean off between 2 to 3 weeks. So usually, and these are really frequent, the nausea usually happen to all the patients that start this type of medication. Of course, you will be always aware when you start this type of treatment by your team, but yeah, it's really a way to try to cope with it. There is different types of ways to avoid this discomfort, or you can take some anti-sickness tablets, or you eat less and less amount of food during the day. So, but again, this medication is have really good outcomes. And weight loss is another side effect that it's really good. You have people with diabetes that are on this medication that feel that they lost weight, also because and they always also report that in a 3-course meal they wouldn't even reach the dessert because they feel full already because of this delayed stomach emptiness, etc. Pancreatitis is a side effect, but not as a must. It was recorded in a really small amount of patients that started in a long term this type of treatments. So each brand will have its own specific care, handling, the timing and injection techniques, which I will tell you a little bit about, and I'll do some videos about these different devices in the future. Now, as I said, this usually will wear off in a couple of weeks. In case of acute abdominal pain, and medication should be put on hold and seek medical advice. That's really important. So just hold it and try to understand why you have this abdominal pain, usually when it's sided on your abdo area. Okay, so these are the more used injectable therapy that it's used for diabetes. Maybe you already know them. So you have the Bydureon. This medication, they all come already in the pre-filled pens, already ready to be used, but in fact the Bydureon needs slightly more handling, more treatment, more care about the way you do the injection and you prepare the medication. But for example, the Bydureon is a medication that is taken once a week. So you will choose your day of the week that you want to do it, usually around the same time. Already with the only downside of it is really the way of preparing the medication, because it has a powder that takes long time to be diluted and to be ready to be used, and the needle is slightly bigger, but they have really good outcome. regarding blood glucose control, weight loss, etc. It's a really good medication. Trulicity is quite recent. You have 2 doses depending on age and really usually patients that are not really coping with a higher dose maybe can be trialed on smaller dose, and maybe they will cope with the side effects like the nausea with a smaller dose. These are really easy pens to use. I will do videos about these pen devices in the future. The Victoza is the Trulicity again, sorry, it's once weekly also, as well as Bydureon. Victoza, it's another GLP-1 that it's taken once a day, usually around the same time. It has different doses. You start with 0.6, and then within a few weeks, you will be increased by 1.2. There is also 1.8, but there is not really a good difference or better outcomes if you go on 1.8, sorry. Nalixemia, it's not being used that much. I don't see it really around. I really don't suggest it to the patients, but are the same. It has to be done, has a specific way of handling. The pen, as you can see, that the red space, the red dot, it changes, and the pen device will make the injection for yourself, but you have to prepare it in advance. And this should be taken within 1 hour before you have your meal. Should be taken the same time, and it's everyday injection also. Majority of these pens should be kept in the fridge. The Trulicity and Bydureon and Lixumia, I would say. Not sure about the Lixumia. Has to be kept in the fridge and taken from there straight forward and be used. The Victozas should be outside, but of course the extra pen should be in the fridge. Going now to Gliflozins, what's the posh name for it is the SGLT2 inhibitors. So these are 3 of the types of names of these medication groups. You have the Invokana, which is the kind of Gliflozin, the Jardiance, the empagliflozin, and the Forxiga, which is the dapagliflozin. Maybe you can, at the moment, you are using some generic name. So this medication is really, I think it's really smart type of medication, because in our kidneys, we have, just before you have a urine going to your bladder or being produced, you have 2 types of systems that will absorb the sugar in your body. That's normal system that everyone has. And you have the SGLT1 and the SGLT2. The SGLT1 just do first absorption of around, I would say, 9% or less of the amount of sugar that you have in the urine before it comes really to the urine and to the bladder. And then there is a second stage, that it's the SGLT2 that will bring the mature 90% or 91% that it's in the urine, that before it goes to the bladder, think about this way, that it's reabsorbed. So basically this medication, again, is the SGLT2 inhibitor, means that it will inhibit this SGLT2, like think about it as a system. So if you inhibit this SGLT2, it means that this 90% of glucose that it's normally absorbed, it's not going to be, so the glucose is going really in the urine, going to the bladder and being excreted in your urine. So and that's how it works. Basically, the glucose is removed from your body through the urine due to inhibition of the glucose reabsorption in the kidneys, as I explained. And with this, it really reduces the blood glucose levels. So side effects, because you are you are peeing out the glucose, the sugar you have in excess in your body, the urine will be more sweet. So it's really normal that patients talk about thrush urinary infection. So this is really important to keep hydrated, as we will see in the tips and more. So and risk of hydration, of course, because the kidneys drink is to get rid of the sugar, and weight loss, because along with the urine, along with glucose that you are peeing, you are also peeing lots of calories, which is really good uh, to lose some weight. Tips more, again, keep hydrated because you are peeing more. You need to continue to drink more, and so on. And if you drink more, also you have some the urine is more diluted, so there is less risk of you to have some thrush. Keep good intimate hygiene, that's really important, and take the tablet in the morning to avoid waking up during the night to pass urine. This is really focusing on someone that will have a normal daily basis of working during the day and sleeping at night. I would suggest that patients that, for example, are doing night shifts majority of time, I would advise you maybe to take them so you are more able to go to the toilet and not waking up in the morning, not waking up during the day while you're sleeping, isn't it? So it's very important for everyone to have a good sleep. So it's really trying to think about when you take the tablet, you are going more to the toilet to pass urine. So try to adjust this to your daily living. Of course, that if you have high blood sugar, the tablet will start working, and maybe you will go to the toilet and you have this type of the side effects I told you about more frequently, because of the blood sugars are high, and then you will reach a stage that the blood sugars are a little bit more controlled. You're not going so much to the toilet, or your blood glucose is not so raised. So thinking about what we have discussed, medication, now it's easy to understand that all the medication for type 2 diabetes are focused to stop the hyperglycemia, that apart from that, the one that we already know the cause, that the carbohydrates not being broken down in sugar, and the uptake of the glucose, that it's glucose, the sugar that it's been produced by the breakdown of the carbohydrates and the uptake of this glucose through the cells. There are lots of other things that we have to consider, and that's why we have all this type of medication that will try to solve the problems that are bringing the blood sugars high along our organs. And all this, again, this is studies that being done in labs, in universities, and every year there are different things that we are figuring out and discovering about diabetes, and maybe there's something else that we could do. So just going back to a little bit about talking about our service. So we have diabetes coaching services, that it's a Skype consultation. So basically in the first appointment, we will do an initial assessment. I will know more about you, who you are, your past medical history, your surgical history, your social history, in a way. You live alone, how old are you, if you work or not. I will understand your medication regimen, what are you doing, if there's anything that can be changed regarding your medication hours, or anything that maybe we could suggest to be done or to change. Of course, we'll together establish targets for the blood glucose levels before meals or after meals or before going to bed, and we have a discussion on this, because it's really important. If you have a target, you will be more likely to have at least motivation to look forward to meet that target. And we are, with our diabetes coaching and our appointments, virtual appointments, we will get into these targets, and we understand how we can really reach them. The glucose levels, the HbA1c. And of course, I will advise you about your diet and lifestyle. I'm not going to say don't do this, this or that. I'm just providing you tips, maybe finding other type of diet that will suit your lifestyle and your needs. Talking about maybe low carb diets, or thinking about maybe something different that you could do, reduce your fruit intake, or maybe some doubts that you have, and I'm pretty sure you will have them regarding diet and diet. Though sometimes we are still talking about diet and diabetes, but we now talk about a healthy diet, healthy lifestyle for everyone, even diabetes. And of course, we always do follow-ups as suits you and as suits the customer. So because you are now seeing this presentation, and thank you very much for attending once again, we have a really special offer. So if you are interested to have this this initial appointment, I am really glad to inform you that I will provide for free appointment until the end of May. So if you send me an email with your from the email that you use with your registration, and telling that you are really wanted to come and join and do this Skype consultation, diabetes coaching with me, we can always schedule your appointment because it will be free. So get ready, start doing your emails, and send us an email with your details and we can book you in. I'm going for some Q&A now. I don't think there's any. If you have any questions after you see this video, I will gladly reply to you via email, or you can always do your questions underneath the video when it's already on YouTube, if you are seeing it after this webinar live. This is our last thank you slide, and please follow us on Facebook, Daybetes. We have also Instagram, Daybetes. The names are pretty much the same, but for Twitter it's day_betes, and of course YouTube that you're already on now. Like us on Facebook, share us around your family or friends. If someone has diabetes, please let them know that we have this great service of diabetes coaching and Skype online appointments. And thank you very much for your attention. Thank you very much. Take care.